This year, Medicare Advantage companies denied over 40 million prior authorization requests. 40 million. That is 40 million times that an American senior went to their doctor, got told they needed a treatment, a procedure, or a medication, and had an insurance company say no. Not a doctor, not a specialist, an insurance company. And the same companies doing the denying collected over $450 billion from the federal government to cover that care. If that number does not make you furious, let me tell you what it looks like up close. Because there is a very real chance that your Medicare Advantage plan has already denied something your doctor ordered. Most people never find out it happened. Most people never know they had the right to fight it. And most people have no idea that the plan they were sold as free coverage was built around a financial model that profits every single time it tells you no. I am going to show you 5 traps sitting inside Medicare Advantage plans right now. I am going to show you the specific ways they are designed to cost you money. And I am going to show you the exact federal protections you already have that the insurance companies are counting on you never using. Here is the thing they do not tell you when you sign up. Medicare Advantage is not Medicare. Original Medicare is a federal program. You paid into it your entire working life. When you are on Original Medicare, the government covers your care. You can see any doctor in the country who accepts Medicare. No networks, no gatekeepers, no company standing between you and your treatment. Medicare Advantage is a private product. When you enroll, you hand your Medicare benefits over to UnitedHealth or Humana or Aetna. The federal government pays that company a fixed monthly amount on your behalf. That company then becomes responsible for covering your care, and they get to set their own rules about what they cover, who you can see, and what requires their approval first. Now, here is the part that should make you angry. Every dollar they do not spend on your care is a dollar they keep. That is not speculation. That is the business model. UnitedHealthcare made $22 billion in profit last year. Their Medicare Advantage division was their single most profitable unit. They also denied more prior authorization requests than any other Medicare Advantage insurer in the country. Those two facts are not a coincidence. They are the same fact. Your insurance company is not in the business of keeping you healthy. It is in the business of collecting your premiums and paying out as little as possible. And Medicare Advantage gives them the legal framework to do exactly that at scale. In 2024, a Senate Help Committee investigation looked directly at this. They subpoenaed internal documents from the 3 largest Medicare Advantage insurers. What they found was that UnitedHealthcare, Humana, and Cigna were denying care that their own internal medical reviewers flagged as appropriate. In plain language, the companies knew the denials were wrong. They issued them anyway. That report is public. It exists, and the companies are still doing it. Let me show you exactly how. Trap 1 is called prior authorization, and it is the engine that makes all of this work. Before you can receive certain treatments, procedures, or medications under a Medicare Advantage plan, your doctor has to ask permission first. That is prior authorization. Your doctor submits a request, the insurance company reviews it, then they approve it or deny it. On Original Medicare, prior authorization requirements barely exist. Your doctor says you need something, you get it. On Medicare Advantage, insurance companies can require prior authorization for almost anything. And according to the Senate investigation, all 3 of the largest insurers were using automated systems to generate bulk denials without individualized medical review. Your doctor says you need a knee replacement. An algorithm says no, not a doctor. A program built to deny. Now here is where it gets worse. The American Journal of Managed Care found that fewer than 1% of Medicare Advantage enrollees who receive a denial ever request an independent appeal. 1%. The insurance companies know this. They are counting on this. Because if you do not appeal, the denial stands. They keep the money, and you either pay out of pocket or go without. There is a woman I want to tell you about. Dorothy is 67 years old. She spent 31 years as a school secretary in Savannah, Georgia. She enrolled in a UnitedHealthcare Medicare Advantage plan when she retired. $0 premium. Seemed like the obvious choice. Then she needed a knee replacement. Her orthopedic surgeon submitted the prior authorization request. UnitedHealthcare denied it. Her surgeon appealed. Denied. He submitted updated imaging and a second clinical opinion. Denied. 4 denials over 5 months. Every letter said the same 4 words. Not medically necessary. She had stopped being able to walk upstairs. She had stopped being able to drive. But here is what UnitedHealthcare did not put in any of those denial letters. Dorothy had a right to an independent review. Not another internal review by UnitedHealthcare's own people. An independent review by a third-party organization with 0 financial relationship to her insurer. She filed the request. The independent reviewer overturned all 4 denials in 9 days. 9 days. After 5 months of waiting and 4 denials, here is the number you need to write down right now. 60 days. You have 60 days from the date on any denial letter to request that independent review. Not 60 days from when you find out about it. 60 days from the letter. After that, the right expires. 40% of Medicare Advantage denials that go to independent review are overturned. 40%. 4 out of 10 denials were wrong, and fewer than 1% of people ever file. They are counting on you not knowing that number. Trap 2 is the one that produces the most expensive surprise bills, and it is completely legal. When you are on original Medicare, you can see any of the roughly 93% of doctors in this country who accept Medicare. No list, no call ahead, no approval needed. Medicare Advantage replaces that with a private network, a list of approved doctors. If you see someone off that list, you pay the full cost or close to it. And that list can change at any point during the year without your permission. Medicare Advantage plans are legally allowed to modify their provider networks mid-year. A cardiologist who is in your network on January 1st can be removed from your network on July 1st. You will not get a phone call. You will get a letter mailed to your address on file. If your address is not current, you will get nothing. And when you see that cardiologist in August thinking you are covered, the bill arrives and the network change was months ago. A Kaiser Family Foundation study found that in certain counties, Medicare Advantage networks excluded up to 40% of the specialists who would have accepted original Medicare. 40% of the doctors who would have seen you are not on the list. Think about what that means for a senior managing multiple conditions. Your cardiologist, your oncologist, your orthopedic surgeon. Each of them is either in your network or they are not. And that status can change while you are in active treatment. There is no requirement for the insurance company to make sure you know before your next appointment. Trap 3 happens every single year, and most people walk straight into it. Every Medicare Advantage plan is allowed to reset its coverage completely once a year. Premium, copays, drug coverage, provider network. All of it can change on January 1st. You are notified in a document called the Annual Notice of Change, mailed in September or October. Most people put it in the recycling bin. In 2024, the average Medicare Advantage enrollee paid 8% more out of pocket than they did the year before. Not because they got sicker, because the plan changed the terms. Premiums went up, copays went up, drugs that cost $10 per month in 2023 cost $65 per month in 2024 because they were moved to a higher cost tier. Same drug, same doctor, same patient, different price. Because the plan decided, here's what they never tell you at enrollment. You have a window to respond. Every year, from October 15th to December 7th, you can review your plan, compare it to alternatives, and switch. That is the annual enrollment period. After December 7th, that window closes and you are locked in for the next 12 months. Most people do not use it. Not because their plan is the best option available, because they did not know the window existed, or they assumed nothing changed, or they got the annual notice of change and threw it away without reading it. The insurance company renewed their contract with you automatically, and they charged you more for less. Trap 4 is the one that feels like protection until the moment it fails you. Medicare Advantage plans are required to have an out-of-pocket maximum. In 2025, the federal limit is $8,500 for in-network services. When your agent explained this to you at enrollment, they probably called it your ceiling, the most you will ever pay in a year. A safety net. It is not a ceiling. Here is why. Your drug costs under Medicare Part D are counted separately. Your medical out-of-pocket and your prescription drug out-of-pocket run in two different buckets. So if you hit your $8,500 medical maximum and you are also on maintenance medications for a serious condition, those drug costs keep adding up. The ceiling only covers one part of your care. A 2023 Commonwealth Fund study found that nearly 1 in 5 Medicare Advantage enrollees with a serious illness spent more than $10,000 out of pocket in a single year on a plan with an $8,500 cap. How is that possible? Because the cap never covered everything, and the way it was explained during enrollment made it sound like it did. That gap between what you were told and what the plan actually covers is not a misunderstanding. It is how the product was designed. Trap 5 is the one that makes me the most angry, because by the time most people discover it, there is nothing they can do about it. Robert is 71 years old. He retired from a manufacturing plant in Toledo, Ohio. When he turned 65, a Humana agent told him Medicare Advantage was the smart choice. Lower premiums than a Medigap supplement, extra benefits. He signed the form. 6 years later, Robert has atrial fibrillation. His cardiologist left his plan's network. His medication requests keep getting denied. He has had enough. He wants out. He wants original Medicare and a real Medigap supplement so he can see any doctor he needs. He cannot get one at a normal price. Here is what Humana did not tell him at age 65. When you first enroll in Medicare, you have a guaranteed issue right for Medigap supplemental coverage. For 6 months after your Part B start date, insurance companies are legally required to sell you any Medigap policy at the standard rate. They cannot deny you for pre-existing conditions. They cannot charge you more because of your health history. That window is 6 months, then it is gone. If you switch back to original Medicare years later after a stint on Medicare Advantage, that window does not come back. In most states, insurance companies can review your health history. They can deny you for Medigap coverage entirely. And if they accept you, they can charge you whatever they want based on your conditions. Robert has atrial fibrillation. In most states, that gets you either a denial or a premium so high you cannot afford it. The Medigap policy that would have cost him $160 a month at 65 could cost $450 at 71. If he can get it at all, he has developed health conditions. Because 6 years passed. Because he is a human being. And the insurance company that collected his premiums for 6 years never mentioned that leaving their plan later would become this hard. That is not a disclosure problem. That is a design decision. The plan was more profitable with Robert inside it than with Robert knowing his options. So they never told him his options. So let me give you what they will not. First, every denial has a 60-day clock. If your Medicare Advantage plan denies any claim or prior authorization request, you have 60 days from the date on that denial letter to request an independent review through the qualified independent contractor process. This is a federally mandated review. The reviewer has no financial relationship with your insurer. Their decision is binding. The insurance company must follow it. 40% of cases that reach independent review are overturned in the patient's favor. 40%. You have a nearly 1 in 2 chance of winning, and fewer than 1% of people ever file. That changes today for everyone watching this video. Second, read the annual notice of change every October. It will arrive by mail. It looks like junk mail. It is not. It contains every change your plan is making for the next year. Look at the premium. Look at the drug formulary. Look at the provider network. If your doctor is no longer listed or your medication moved to a higher tier, you have a window from October 15th to December 7th to switch plans. After December 7th, you are locked in. Set a reminder right now. Every October 15th, read that document before you do anything else. Third, if you have not enrolled in Medicare yet, or if you have a parent approaching 65, talk to a SHIP counselor first. SHIP stands for State Health Insurance Assistance Program. Every state has one. The counselors are free. They take no commission from any insurance company. They will walk you through both options with no sales agenda. You can find your state's program at shiphelp.org. This conversation before enrollment is the single highest value thing a senior can do. It takes 1 hour. It can prevent 10 years of the wrong plan. Fourth, if you are on Medicare Advantage and considering leaving, check your state's Medigap rules before you disenroll. New York, Connecticut, and Massachusetts have expanded guaranteed issue protections that let you switch back at any age. Most states do not. If you are in a state with no expanded protections and you have developed health conditions, get the Medigap quote first before you cancel your Medicare Advantage plan. Know the number, then decide. If you have received a denial in the last 60 days, drop a comment below. Tell me what happened. You are not alone. And someone else watching this video right now is going to read your comment and realize they have the same right you just learned about. Let me tell you what these 5 traps have in common. None of them are accidents. None of them are oversights. They are features of a system that was designed to extract maximum revenue from people who spent their entire working lives paying into a promise and who trusted an insurance agent and a brochure to explain what they were signing. UnitedHealth made $22 billion in profit last year. Humana made $3,700 in profit per Medicare Advantage enrollee. Aetna paid its CEO over $20 million in 2023. These are not companies that are struggling to survive while they make difficult coverage decisions. They are companies that built a product around the statistical certainty that most people will not read the annual notice of change, that most people will not request an independent review, that most people will not find out about the Medigap lock-in until they are already locked in. Most people, not you. You came into this video knowing Medicare Advantage was something you signed up for. You are leaving it knowing it is a private financial product built around a model that profits from your ignorance. You know the 60-day window. You know the independent review process. You know the annual enrollment window. And if you have a parent on one of these plans, you now have the information to protect them before the traps close. If you have a spouse, a sibling, a parent who is on Medicare Advantage right now, send them this video, because the information I just gave you is not complicated. It just requires someone to actually say it out loud. If you want to keep getting information like this, the kind your insurance company will never put in a brochure, subscribe. Every week, I cover a different rule, policy, or practice that the insurance industry is counting on you not understanding. They built these traps on one assumption, that you would never look.